So today we're doing the peripheral vascular exam. We're going to start with the upper extremity. I'd have my patient in a gown and make sure everything's skin on skin. Just for making it more simple and comfortable today, we're just going to do everything over the top. So first I would just look from his axilla down to his hands. Make sure there's no lesions, bumps, scars, anything like that. Next I would do a temperature test. So I go on the inside from up the top of the arm down, and I would also go on the inside and outside. Next is nail compression test, so we can just use his index here, push on the nail, make it white, make sure that the blood comes back in a good amount of time. Same thing, you're going to do it bilaterally. It's good. Next is the hydration test, so you're just going to take the skin on the top of their hand, pull it up a little bit, make sure it goes back. Good, he's got good hydration in there. So next are the pulses. We got radial, ulnar, and brachial. We can do the radial and ulnar bilaterally. So we're just going to pump it. I'd have him take off his watch, but again, for easiness, we're not. Alright, that's radial. They're even on both sides, and ulnar. Good. And then for the brachial, we're going to do it one at a time here. And really, we're just checking that the rate, pulse, make sure everything's equal on both sides and nothing abnormal. That's all good. So next we can move into the lymph nodes. First one we're going to do is the epitrochlear. So we're just going to take his hand, and right where the biceps and triceps split, right up here, we can feel in that area, and we really shouldn't feel anything, which I don't, and that's great. We do that bilaterally. Next is the axillary lymph nodes. So there's anterior, lateral, medial, and posterior. We're going to go alongside the thoracic cage. So first one's just behind the pec here. Then we can go back by the subscap, get under the scapula. Then we can go lateral, and the medial's right in there. Good, and that's the upper extremity. So we're going to move on to the lower extremity. And the first thing we're going to do here is, again, just observe from the hips down to the feet and toes. Again, same thing as before, look for any lesions, lumps, bumps, anything that would be abnormal, rashes. Then we can do skin temperature. Up top, go down all the way to the toes. Make sure it's bilateral on both sides. Nail compression, we can just use the big toe for this. Same thing as the top. You're just pressing, making sure the color comes back in a good amount of time. Pitting edema, so for this we were going to push on 3 points. The first one is the top of the foot, then the shins, and the medial malleolus. What we're looking for here is that an indentation would stay after we push, which would be a problem. He doesn't have that, so that's good. While we're kind of doing the pitting edema and feeling and stuff, we can see if we suspect any skin thickening, and then we would palpate further in that. We did not suspect any, so we can skip that step. Next thing we have are the pulses. The first one is the dorsalis pedis, which is going to be on the top of the foot. I'm just going to have him extend his big toe, and then it should be just lateral to that. Good. And the next one is the posterior tib, which is going to be right behind the malleolus. And we can feel that. Then popliteal, which you can do it laying down, is probably easier, but we can just feel, just relax your leg, and we can just kind of got to dig in there, and we can feel the pulse there on the back of the knee. And the last one is the femoral, so I am just going to have him lay on his back for me. And here, if you're not sure where the femoral is, you can have your patient locate his pubic bone and his ASIS, and it should kind of be right in between those. And you just feel right in there for the pulse. Good. And next, we can move on to lymph nodes. The first one is the inguinal lymph nodes. So there's vertical and horizontal. So we're just going to start with the horizontal and just kind of feel if any of those feel inflamed. And then the vertical is going to be down the medial thigh. We don't feel anything, which is good. The next thing we're going to do is the auscultation. So here we're just going to the femoral artery and listening to it with our bell. We're just going to listen and see if we hear any bruits or anything abnormal. Good, so we didn't hear anything abnormal. Again, with this and everything that we've been doing, we want it to be skin on skin, but we're just not going to do that today. Next is for checking for femoral hernias. So can just kind of do that bilaterally. Right below the inguinal ligament, just kind of feel and see if there's any masses or if the patient has any signs of apprehension. Next is Holman's sign. So what I'm going to do here is just lift his foot about 45 degrees, have him dorsiflex his ankle, and I'm going to squeeze his calf. Do you have any pain there? That's good. We can do that bilaterally. Then the leg elevation test. So here what I'm going to do is I'm going to lift both of his legs here. I'm going to put it on my leg and just ask him to flutter his foot like he's kicking water. And we're going to do this until his feet get white, where the blood's draining out, which could be about 60 seconds. We're just going to let him stop here, and then I'd have him sit on his feet, or sit up, stand up, whatever he wants to do, and look as the blood goes back into his feet, making sure that it comes back at a reasonable time. And then the last thing, he's going to be standing. I'm just going to place my hand at like the upper medial thigh, just below the inguinal ligament, and then I'm going to tap on the medial aspect of his femur right at his knee, and I'm going to feel if I feel any vibrations into my hand, which could mean something's like stuck and the blood flow isn't good. And I feel that, so that's good. And that concludes the exam.